Well, the reason these young Hollywood starlets continue in their behavior with no one intervening, including their families, starts in early childhood. The behaviors of obsessiveness and impulsiveness are tolerated and even supported, and the more that this occurs, the more that these behaviors are manifested. And as time goes on, the studios, the handlers, everyone continues to support this behavior without anyone confronting. And it's difficult to approach these people and talk to them about it because nobody wants to lose their approval or be alienated from them. There's a big increase in the number of medical marijuana facilities we're seeing in California, and it makes me sick as a drug and alcohol treatment provider. We're out there trying to help people get off these substances, and other entities are there making it easier for them to become addicted. Okay, we're seeing a sharp increase in prescription drug abuse amongst Americans 12 years and older. And there's also a pervasive pattern of denial amongst these individuals, their families, the schools, and everyone involved. And rather than confronting these individuals and their families with facts and trying to force them into change, we need to be more compassionate and understanding towards them and take a slower approach using education and support in order to create the changes we're looking for. Some of the dangers associated with the reality TV shows relating to addiction and recovery are that people without proper training or understanding of the goals and outcomes that one is looking for is that they're going to meet with these individuals and be confrontive, angry, and really just serving to meet their needs by getting things off their chest or letting them know how they feel without really keeping the individual's best interest in mind. And so it really takes a professional to deal with these situations in order to achieve the desired outcomes, which is recovery and abstinence from substances. We're all familiar with post-traumatic stress as it relates to the men and women in the armed forces, but what we might be unaware of is people in our society who haven't served in combat, who've still experienced traumatic experiences, same symptomatology, same need for treatment. Many times these people turn to substances to help them deal with this post-traumatic stress, when in reality there are better and more beneficial ways to cope with this. For example, psychotherapy and support groups. One of the things that sets A Better Tomorrow apart from other treatment programs is that we focus on evidence-based techniques. And these are techniques that have been researched and documented to create changes that individuals are looking for. So rather than focus on horseback riding, massage therapy, and yoga, we focus on treatment techniques that are going to bring about the changes that will improve people's lives.